Hi, everyone. My name is Dr. Gina Calderone. I am a doctor of physical therapy. Welcome to Why Your Body Still Hurts, Connecting the Body and Mind for Pain Relief. I'm the founder of Physio-Energetic Therapy. Um, I've been a physical therapist for 24 years, and I started off in a very traditional setting. I was stretching muscles, mobilizing joints, and doing all the things that physical therapists were trained to do. And I noticed that all of my patients were very, very stressed. And so I used a technique called craniosacral therapy that I had learned in PT school. And I noticed that people became relaxed. And I was also trained in Pilates and gyrotonic, and I started to mobilize the rib cage and work on those tissues, work on breathing, and notice that and with posture, and just notice that people started to relax even more when I combined that with the craniosacral work. And they started talking about their lives. They started talking about things that was not mentioned on the intake form, and I just thought it was super fascinating. So I started a cash pay physical therapy business in 2004, and it gave me the space to expand my curiosity. So before we begin, I just want to say that this is an educational presentation for clinicians and the public. It does not establish a provider-patient relationship, and topics may include trauma, abuse, grief, anxiety, depression, addiction, and suicide, and continue to work with your healthcare providers. Have you ever thought of these questions, right? When I started my cash pay PT business, because it just wasn't a thing at that time, it was not, people were like, why am I going to pay you cash when I have physical therapy benefits? It was just like such the thing. So I really started as a personal trainer. I started, more in a Pilates field and kind of blended it all in. But I was studying medical intuition and energy medicine at the time that focuses on life experiences and spirituality in the body. And it started to change my perspective about the roots of pain. So, what if your body has been responding to your life? That was the question I started asking more and more about every single patient that was coming in. And this light bulb turned on, and the curiosity grew, and I began to ask more and more questions. I became like a body detective. I was just like, what else has gone on in this person's life? And most of the time, they just like ran with it, and they just started talking more and more. And I started to see, like, why did my pain begin when it did? It began around impactful events or shortly thereafter, or sometimes even before. And why does it keep coming back? Because that pain became a memory. It was a shock at the time that it happened with certain people. And um, it really stayed in the tissues. Sometimes it formed the posture. It just started to form their physiology. And why do I still hurt after trying so many treatments? Because it really is emotional, and we can't stretch the emotion. It's something that they have to feel. And I was like, how are we going to do this? And it was just like asking a little bit more of the question. And a lot of times my patients knew, they already knew what it was. And so, the physical modalities that we were doing, such as physical therapy or chiropractic care or massage, whatever we were doing, it's like those physical modalities were not treating the emotional pain. And it started to show me that emotional pain is physical pain. And why do I feel like something is missing? That is like that deep soul question that it's just like there's something unresolved in me. There's something, and we just know. We just know. Sometimes we just don't know how to get there, and we need some guidance. If you answered yes to any of those questions, you're not alone. People tell me this all the time. The first call I have with clients is a mixture of all of these statements. It's been 2 decades of I've tried everything. And a lot of times when they call me, I'm like having to convince them that it's emotional, which is difficult. I have a crafty way of doing it, but um, they've tried PT, they've tried chiropractic, they've tried medications, injections, or surgeries, or they're trying to prevent that, which I respect and understand. Um, They've even gone as far as like acupuncture, and they're like, I really strayed and tried that too. But they're frustrated because all the tests are normal. It's not like we're trying to look for something on these tests. We don't want something to show up in the blood work. We don't want something to show up on the MRI or the CAT scan. We really don't. But like, why do I feel so crummy? And why do I have this pain? Um, because emotions, you can't see them on those scans. That is energy medicine. It happens often long time before anything shows up in your blood work or on your scan. And those are the symptoms and the messengers that we're really trying to connect with, that we can shift those so that the pain, goes away. It's like more of a prevention. And nobody can explain my pain because it's subtle. Emotion is very subtle in the body. It's energy. And the talk therapy, I meet people all the time that have been to talk therapy and they maybe hit a wall, or it's just, but like my body still hurts. And I'm like, well, a lot of times we're just talking and looping in the mind and we're trying to intellectualize that pain, but actually the pain is in the body. It happened, something happened to the body in that moment. It shaped everything. And so we can talk about it, but a lot of times when we talk about it and I'll ask the questions, they have the answers, they're on my table, and then I'm like downloading it right through the body so that they can release it. So, what you'll discover today and what I'm going to go over in the next 20 or so minutes is how emotional stress can become physical pain, why when your pain began matters as much as where it hurts. And the first step I use to help clients connect the dots, like that is it right there. This is a new resource that I'm going to share at the end of if you want to continue learning. Like this has been so many years of trying to figure out like why people are in emotional pain and how, and then like how it shows up in Western medicine as certain diagnoses and patterns and symptoms. And it's been a fascinating ride. I want to share a bit with you today. So, the origin of physio-energetic therapy, it's like I said, it's been 20 years of treating pain and just asking questions and becoming really curious and expanding and expanding and expanding my thoughts on what I would see. And I would just treat families mainly, like uh, families would refer me to their friends, or in comes the children, in comes the dad, and then in comes the mom, or however. And just like it was just all these connections, and it really gave me that cash pay PT practice. I'm so grateful for and starting that because it really gave me the freedom to ask a lot of these questions and the time. I wouldn't have had that time. I started off in a traditional setting with 23 patients a day, and I had 15 minutes. I had no time to do that. So this allowed me that time. But one day early in my private practice, a young man walked in and he had chronic right shoulder pain. And like any PT would do, I asked him when his pain started. And at that moment, like the volume in my ears changed. It like perked up. There was like a different vibration. And he's like, well, when my dad died, and I'm like, wait a second. And so emotional mapping, what I'd been learning in energy medicine, medical intuition, learning all of it, I'm like, wait, right side of the body is masculine. It's in the heart line. The core emotion of the lungs is grief. Liver can refer to the right shoulder. The core emotion of the liver is anger. So I'm like, boom, 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 boom. And I'm like, huh. Well, how was your relationship with your dad? He's like, well, it was all the answers that were in that, like what I was looking for. I'm like, bam, that's it. And it was like just person after person after person. It was just the answers I was looking for. And of course, the shoulder pain went away and it took off. And so what is physio-energetic therapy? Physio in Australia. Y'all are called physios, and I love that here. I want to be a physio. We call them physical therapists. I'm all, like, I like physio. I think that's kind of cool. So, honestly, that's why I loved it in the beginning when I was learning all of this. I was writing a blog and I was connecting with a lot of people from Australia and New Zealand, and they were the physios and they had kinesiology backgrounds, which is my undergraduate degree. And I'm like, oh, this is so cool. We don't do this so much over in the States. So I was really inspired. And energy became it's the flow of life through the body. It's just all the things that happen to us. and how it shapes our lives. And I had an energy medicine teacher teach me this demonstration, and I just wanted to show you. This is a towel, okay? This is the physical body. My hand is the energy body. It animates, okay? So when this energy goes into the physical body, it animates, and this is who we are. And so when we're having a great day, it's like, yay, like life is awesome. I have lots of energy in my body. And when things happen and make us really sad or devastated, it's just like, "Arr," and we just don't move as much and we don't have much life flowing through us because life happened to us and we don't know how to pick ourselves back up. And so it just doesn't move. And but it's just how that energy is flowing through. So it taught me a lot about depression. It taught me a lot about anxiety in learning energy. So physioenergetic therapy is a whole person approach that explores how life experiences influence the nervous system, posture, movement, breathing, and pain. It's wild to sit here like 20 plus years later and like give you this like simple flow chart, which when I started, I was like, what am I doing? Like what is going on? And I'm a PT, right? So at the bottom of this chart where it says body adaptations, breathing, muscle tension, posture, movement, that's what we're taught. And we're taught physical symptoms and pain. That's what people come to us with. So we're like, okay, your back hurts. We're going to stretch your hamstrings. We're going to make sure your core is connected. And, I really used my Pilates and gyrotonic background, which is all core centering methods. And when I just noticed that most people's core muscles were not like engaged and turned on, and when we got those to fire and coordinated it with that with the breath, it was like a light bulb went off and they were like connected inside their body and they can start to feel like interoceptively like what's happening inside and feeling sensations and then starting to pick up what's going on the outside. And I was like, oh wow, there's a whole sensory thing going on. And then as I was doing that craniosacral work, which is cranium sacrum, right? So it is that work gets into the parasympathetic part of the body and in the nervous system, which is calm and rest and digest, and just people would automatically calm. The opposite is sympathetic, which is fight or flight. So I realized I was working with gut, heart rate, breathing rate, brain, and it took a long time to figure out that that's what was going on because I was just working with tissues, and I'm like, oh, wait, you were diagnosed with an eating disorder? Wait, and it's better? Like you have an appetite now because we got the trauma out? Like, oh, huh, okay. And so it just taught me more about the tissues and how it changes the perspective of the brain. And a young man, I was working on his low back, and in passing, this was many sessions later, he's like, oh, I drowned when I was 2. And I'm like, you did? And he goes, I didn't tell you that. And I go, no. So memories would pop up as we're moving along the chain, right? And he's like, yeah, that's when my parents got divorced. And I'm like, oh, that holds a lot of, I'm thinking to myself, that holds a lot of grief, guilt, shame. Like, huh. And he felt it. And we talked about it for like a split second. And then it was like, oh, okay, let's get in. This is how you connect the core muscles. And it shifted his whole perspective, took the guilt off of him. But it just, as you can see, it's going up, right? I should really turn these arrows back, that it goes back to life experiences. I'm going to do that on the next slide or the next presentation. I got to turn those arrows around. But that's it. I was going back. But this is how I learned. I was like going backwards. So the patterns I began seeing that the pain is not random. Everything had a story to it. So the migraines and the headaches that came in was just mental overload. Thoughts looping, very intellectual, maybe trying to intellectualize that pain, not really understanding. This was before somatics kind of started coming in as it is now, which you can imagine my mind's like, wow, like this whole world's starting to open up now. It's so cool. Like people are going to start healing and this is going to get so much better. But it kind of exploded. Shoulders, shoulder pain, lots of responsibility, fawning responses, people pleasing. Sometimes in the family structure, they're the oldest sibling, everything's placed on them, and it just carries with you forever. It just like it's kind of how you approach life. So, um, and then going into jaw and neck. So people that had, they were holding back their emotions. They didn't know how to express them. A lot of fear stuck in there. Again, that goes back to family systems. Perhaps they couldn't say anything back. So it was like more of a power over system. So it holds in the jaw, it holds in the neck, and there's so much that they want to say that we don't know how and how to connect to that. And there's different ways in doing that. And low back, I learned was survival, a lot of financial and money issues every single day. Life can be so stressful trying to, figure out how to pay your rent and mortgage and dinners and family and all the things. So that's really where I saw most of low back pain. And hips were in transitions, empty nesters, um, a job that they felt stuck in and could and like just no spark for that anymore, or maybe there never was, but yet there's this purpose trying to emerge and trying to push through, and it was something that they needed to move forward to. And gut pain is always stress. Always, always so much stress. One patient that changed everything for me, this was still when I was in the beginning, and it really took me out of the box of PT and really blew the doors and walls down. But she was a young mother with unexplained chronic gut pain. It was pretty bad. She had a 4-year-old, but her mother was my client, and her mother was so concerned about her. She had been to every doctor, tried every medication, doing test after test after test after test, started going to functional medicine doctors and doing all of that. And I'm just like thinking, say it, Gina, say that you can help her. Like, and I finally like mustered up the courage and I'm like, I think I can help her. And she came in one day, and what I noticed when she walked through the door, I noticed posture. I'm a PT member. And so her hips were thrusted forward, her back was extended, and she walked like she was pregnant. She was very thin. I was like, that's interesting. So I note it. This is what I still do to this day. I just note it. I put it on a little sticky note in my head and I stick it up on the wall in my mind and I come back to it later. And we got to the story part in which I hold that space, and that space has gotten bigger and bigger for stories that are bigger and deeper over the years. It's like really, really big now because I'm like, I never know what people are going to say. And I'm okay with that. It took time to do that too. But she lost her newborn at her first baby at 7 days old. You can imagine the shock, the trauma, the pain. She never she never closed that chapter. It was very unresolved. We talked about like maybe holding a ceremony, so she did. She invited her close family and said goodbye to this little baby, and um, she healed. She was better. And that moment really changed how I understood healing. So I worked on the gut tissues, I worked on the back tissues, I worked on the rib cage, I reconnected the breath back to the core, and I was like, oh, interesting. And look where it is today. So this is the emotional pain chart I created in gosh, I think it was like 2007, based off the work of Louise Hay. She's an author and motivational teacher, best known for her work exploring the relationship between thoughts, emotions, and the physical body. Really, it was my guide. And I just made a poster out of it and put my branding, and I like shared it one day, like so loosely on Facebook. I'm like, wow, like look at this chart I made. And like a year or two later, it came back and it like went viral. And I'm like, what is happening? Like I had put it on my new website. My web designer was like, your website's crashing. You need more storage space. I'm like, why? And she's all, people are like downloading that chart like crazy. And I'm like, oh, okay. So people are interested in emotional pain and how it causes physical pain. So it just really continued the journey. And so I am really, really excited to introduce the emotional pain mapping online course that I created. It's an introductory physioenergetic course. It includes all of these things listed. And what's really cool is it has CEUs for physical therapy, which is like, ooh, Ooh, you guys, you don't know how many times I tried to present to physical therapy associations, like just everywhere, and I always got pushback. So it's been a journey of pushing back and like just still standing there, even though people are looking at you like you're crazy. And here we are. And now so many books are written about it. And it's just like, oh, like I have chills right now. So it's cool. It's been a really, really interesting process and understanding. And this is a review that a woman had left me, but when people, people are all over the world, and I've made a list of where people are in the world and places that maybe one day I could teach. And when they can't work with me in person, or perhaps the resources aren't there, this course is perfect for that because it really helps you understand the beginning so you can start mapping out your emotions in your body on a timeline and all of that stuff. But for individuals, it's going to help you understand your pain holistically, connect to body mind healing, and really feel empowered. That's the best part about it. I like that. People really step into their power when their subconscious memories are stuck in the body. And then they start to connect that to the mind, the empowerment just expands. And for practitioners, I feel like it builds deep trust in your patients. That's why I work with families, and it continues to be that way. It expands your clinical reasoning and hypothesis, so you can really start to understand the root of what's going on. And I'm telling you, when you start working, well, most of the time, if you're working on your clients or your patients, you're already working on them physically, and they are already talking about whatever is kind of bothering them, or maybe they say it in passing, or maybe they're going through a divorce. And all I did was just be like, how's it going? And they're like, blah, 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 as I'm like mobilizing the shoulder, as I'm working on the soft tissue, as I'm doing all of it. And it's just, I'm like, oh, there it is. Like, let's just release it and reconnect them. So it just makes life more meaningful, and you start to make these really amazing connections. So inside the course, you're going to recognize common emotional pain patterns throughout the body. You're going to understand how the nervous system responds to stress and life experiences. You're going to get the emotional pain chart and understand the body life timeline to connect more body-mind connection. And there's simple tools, guided exercises, case studies, and you're really going to view pain through a whole person physioenergetic lens. This has really helped expand my work in the last 6 years. I have dealt with more mental health disorders and signs and symptoms than ever, and addiction and substance abuse. I'm right now trying to get my body of work into the whole substance abuse and recovery centers, because most of the trauma is in the body. That's where it's at, and that's where we need to focus. So questions that I'm typically asked is, does physioenergetics claim that my pain is psychological instead of physical? No, like, it's, we were always told that the pain is in our head, it's all in our head. And no, it's in your body, shaped by all the things that you've been through. And it would be another discussion to shape all the things that your parents have been through. So that's a whole other conversation. And is this within my scope of practice as a healthcare provider? Absolutely. Absolutely. You can get to know your patients a lot better. And it's just some simple questions. We're not diagnosing anything. A lot of them already know their diagnosis as they're coming in with them, and they're trying to find solutions. And this course is for anybody wanting to look a little bit deeper and to understand some meaning and into their pain and connect the dots. So on my website, you can find the emotional pain mapping course under the learning page and the resources page. The emotional pain chart is there as well. But since you all showed up, I'm so excited and thank you so much. The course is regularly $147, and I'm offering it to you right now for $97. And Elisa is going to put that link in